Welcome to Verified RX, your prescription for success, brought to you by the Vizient Center for Pharmacy Practice Excellence.
In both the inpatient and ambulatory settings, layered learning can strengthen clinical confidence, improve collaboration, and help pharmacy residency programs build a culture of continuous learning. Layered learning is a teaching approach where more experienced learners help guide and train those earlier in their journey, creating an environment where education, mentorship, and patient care all happen simultaneously. Today, Dr. Sarah Eggers-Russell and Dr. Kimberly James join me to discuss how layered learning works in real-world pharmacy residency programs. I'm Carolyn Liptak, Pharmacy Executive Director in Vizient Center for Pharmacy Practice Excellence, and your host. Sarah and Kimberly, welcome to the podcast, and thank you so much for joining me.
Thank you for having me.
Thank you for having us.
Sarah, let's start with you. Give us some background information about your health system and the residency program at UNC Health.
I am a clinical pharmacist practitioner, or CPP, at UNC Health REX. We are embedded into 11 different cardiovascular clinics at the system. I'm also the current residency program director of the ambulatory care program there. We help manage anticoagulation, hyperlipidemia, hypertension, heart failure, and HOCM patients. We all work under a collaborative practice agreement within the practices we are in. We help Precept, PGY2 and AmCare, PGY2 cardiology, and then am an elective for the PGY1 general practice residency. We also take APPEs and IPPEs from 2 different schools of pharmacy in our area.
Sounds great. Kimberly, tell us about your background and residency program at University of Florida Health.
I'm the General Pediatrics Preceptor at UF Health, Florida. We are a large academic medical center with second-year pharmacy students, APPE students, and we also have a large PGY1 acute care pharmacy residency class. And we also have one PGY2 pediatric resident. Our PGY2 resident does have a requirement for a precepting month where they act as a primary preceptor with other opportunities for layered learning within their residency year.
So both very robust programs. At its core, layered learning is less about one teacher delivering everything and more about a team-based learning system where teaching is shared. But help us understand what layered learning looks like in pharmacy training.
Layered learning can have lots of different looks. Advanced learners can actively teach and mentor junior learners under the supervision of their precepting pharmacist. More advanced learners will gain exposure to these precepting skills and modeling professional behaviors, increasing their independence as well as their autonomy. The junior learner will also have a maximized experience in this type of learning environment by having multiple opportunities for one-on-one learning that is more personalized and the ability to get a perspective from another learner while still having preceptor support. So you have lots of different learning styles that you're able to learn from. This also has an increased opportunity for direct patient care by having more learners and by having more patient access to pharmacy team members. And in return, the preceptor will have more time to work on other things they are responsible for within their workload while still ensuring that they are providing an enriching learning environment for their learners.
We all appreciate that extra support while managing your patient care workload. Since pharmacy residents are in a learning environment themselves, how do you help them understand and delineate responsibilities and tasks to the pharmacy students they're precepting?
First thing we need to consider when we do have layered learners is we want to make sure all learners are oriented into the rotation. It's very important to meet with the advanced learner prior to the rotation to discuss the expectations for layered learning and determine their teaching competency level to make sure that they are comfortable teaching the junior learner. If this is a primary precepting month, it's a little bit more autonomous. The PGY2 resident will formulate a calendar with all tasks, topic discussion, projects prior to the rotation even starting. Next, as a preceptor, we'll meet with all learners on the first day of rotation to set up those expectations and defining the roles that each learner will have.
In ambulatory care, we're very similar to what Kimberly mentioned. I will typically meet with the supervising learner or residents prior to the rotation, whether it's like a co-precepting month or a primary precepting month for that resident to determine expectations, roles, especially in relation to evaluations and their goals throughout the rotation as that supervising learner. At the beginning of the month, I meet with all the learners, residents, and our students to say, this is your point person throughout the month. I am overseeing it, but this is your point person or primary preceptor, and delineate the expectations of each learner. We try to tailor the learning experience towards the specific learner, whether it's an IPE or an APPE, and tailor it. So the supervising learner or resident will aid and gather their learning styles, where they are, previous rotations, those sorts of things. The resident is expected to complete the evaluations. On a co-precepting month, we do it together, whereas on a primary precepting month, they are responsible for the written and verbal feedback. I am present so I can give them feedback, especially if there's constructive criticism or conversation, more difficult conversations that happen. Or sometimes if they've never delivered that kind of feedback, I will model for them and am present in the learning experience. So I'm able to model that for them and then let them take the reins at the next go around.
So we know that in pharmacy, some of the best learning happens while teaching others, but not everyone learns the same way. How do you take any learner and make them effective in your practice?
I like to gather all the learners' different learning styles prior to the rotation even starting to best prepare for the rotation. It's important to tailor the rotation to try to meet those needs and the different levels of learners that you may have, whether it's the beginning of the year versus at the end of the year. Depending on what rotations learners had prior to your rotation, this could adjust a little bit as far as the initial load and the complexity of the patient cases that we're discussing, as well as the topic discussions. You want to start small and work up as the learners progress, assigning more tasks as the learners progress through your rotation. At midpoint, it's important that the preceptor checks in with all the learners to evaluate the effectiveness of the rotation and then make adjustments as necessary. The goal is for the junior learners to present their shared patients to the team, with the advanced learner filling in any of the gaps that they have missed, and also proposing alternative plans during rounds. Throughout the rotation, consistency checking in is very important with both learners to ensure that they're both meeting their goals. This can occur as a group setting or individually too, because I do think it's very important that you're checking in with both learners to make sure that they are meeting their goals throughout.
Similar in ambulatory care, so at the beginning of the month or pre-rotation month, we send out an entering interest form to our incoming learners, both residents and students, to gain what field of pharmacy they are interested in. Is there anything that they're looking forward or not looking forward to of the specific rotation? We get a good initial baseline of where the learner is coming into the rotation and how much we will need to handhold or not throughout the rotation clinically. We start with doing point of care tests, getting INRs, lipids, and then we add in the patient interview on top of the point of care test, and then documentation and therapeutic planning, to where they then by the end of the month have it all put together nicely. At the beginning of the month, depending on IPE, APPE, we will have them work up 25 to 50% of the schedule, and then slowly work up to 100% of the schedule if we are able and they are comfortable. We incorporate informal feedback Fridays. The resident runs it if they are the supervising preceptor, and I am always involved just to provide feedback to the resident based on their precepting.
So it sounds like you both have very mature, robust programs, which is great. Can you tell us about some changes or ways that you've set up your rotation specifically to make a layered learning experience successful?
My rotation does look quite a bit different when I have layered learnings instead of single learners. My role consists of quite a few different teams, so I'm able to utilize the learner to increase patient access to the pharmacy team when I do have layered learners. Otherwise, my time is alternating between the teams, so it's quite beneficial to have layered learners on my particular rotation. This is an opportunity to teach advanced learners how to teach and to provide resources for them to become effective preceptors. And it also allows the opportunity for the junior learner to work on those foundational skills that are so important, and allows more time for the advanced learner to be able to focus on developing and improving their own advanced clinical skills. With my particular rotation, I do have a lot of different teams, a lot of consult teams, as well as the general teams. Being able to divide those times accordingly is very helpful for the layered learners.
The preparation does look very different if the resident is expected to primary precept versus kind of like a co-preceptorship. If they are preparing a primary precept on our team, since we are embedded in so many different clinics across the Triangle region, we do a lot of shared precepting because we find the benefit in letting them see diverse patient populations, socioeconomic backgrounds, and clinical practice styles while we're all are doing the same thing. At the end of the day, our pathway to get there may be a little bit different clinically. So we like to do a lot of shared precepting. If the resident is expected to primary precept, we start meeting with them early the month prior to that rotation so that they can help with the coordination piece, the calendar making, because it is a lot of coordination. If they were co-precepting and me walking beside them more, we would pick up a few days before the rotation when some of the other stuff is coordinated and already made so that they can get a good feel for that. But during the rotation, the resident is acting as a point person for the learner, the point person to the team as well. If there are any concerns regarding the learner's progress during that shared precepting, we've also utilized our learners to help reach out with our loss to follow-ups, follow up on lab results, even do some phone visits and drug information questions. So that is very helpful in this layered learning model.
Sarah, can you tell us a little more about how you engage learners without the structure of a clinic visit schedule or rounding service on the days where there are no providers, specifically in the ambulatory setting?
Our team is embedded into 11 different cardiovascular clinics across the Triangle. We each own a clinic schedule where we see 15 to 20 patients depending on the clinic or the day. Clinics are only closed on holidays, and our schedules still run even if the provider is out of office or on vacation that week. So we still see patients consistently. On lighter days and throughout the month, learners may have project days to work on in-services. They also do a POEM presentation, which is patient-oriented evidence that matters. They take a patient case they've seen in clinic and apply it to a clinical trial. So they have those things that they work on. They also work on topic discussion prep, drug information questions as they come up throughout the day, and other curbside consults. While in clinic, we also give them opportunities to observe echocardiograms, stress tests, treadmill, and like the Lexi scans, and see patients with some of our providers to get a different aspect. And the providers also like that for like their drug information questions on the spot. Other opportunities are sometimes available depending on their interests, including spending the day or shadowing a colleague in a different field of ambulatory care pharmacy, or even having topic discussions with those colleagues as well. We utilize our lighter days in clinic to have impromptu topic discussions of something that may come up during patient care.
Kimberly, can you describe the structure at the inpatient setting?
My practice consists of multiple teams. This includes general and consult teams, including GI and cardiology. It includes nephrology, pulmonology, a bunch of different opportunities for students to be able to have engagement with different services. I do ask the learners which types of specialty consult services they may have the most interest in at the beginning of the rotation. So if we do have a lighter day, I can try to provide opportunities to delve into those disease states. This may be rounding with a different team that day so that they can get exposure that way. It could be certain impromptu topic discussions when we're not quite as busy on the general service. We can also involve the junior learner and the advanced learner working on different tasks during these times. I have my learners do a presentation to the pediatric team. I also like them to be able to give pearls to the medical team. At our academic medical center, we do have a lot of rounding with different medical residents and interns, anesthesiologists. So it's a great opportunity to give presentations to other healthcare workers as well. I also have had students shadow nursing, a different perspective on what pharmacy does so that they can have a different appreciation for nursing staff too. I also have the junior learner become involved with a project that can help advance patient care. This is a great way to split tasks when I do have multiple learners to allow the preceptor more time to be able to work on their tasks as well to make sure that these projects are done in a timely manner.
Every time you guys talk about how much work this is, but it also at the same time allows you to get more work done. What words of wisdom or advice do you have for someone who is approaching layered learning for the first time or maybe wants to approach it differently in the future?
It's very important to keep an open mind. Depending on when in the rotation you have learners, you may have different experiences, depending if it's earlier in the year versus later in the year. It is important to be cognizant of where your learners are in their academic journey and to remind them that they are present to learn and to build their skills. We try to keep our learners engaged throughout the whole rotation. Have regular check-ins to make sure that all parties are getting the best experience that they need to succeed. And don't be afraid to approach things a little bit differently depending on the specific needs of your learners.
I agree with everything that Kimberly said. Being flexible and adaptable to meeting the learners where they are and helping them work on a plan that is best for them to help them develop into what they want to be or what their goals are. And then also encouraging learners to have an open mind to enhance their learning. Residents being the supervising preceptor is a great way to do that. Encouraging learners to keep an open mind is huge.
I agree. That is huge. Is there anything we didn't touch on that you think is important for our listeners to know specifically about layered learning?
Layered learning has benefits to all parties. It includes the junior learner, the senior learner, as well as yourself as a preceptor. The junior learner gets to gain a realistic impression of what skills and knowledge level would be required of them as they advance. The advanced learner gains experience in precepting and teaching while building their own clinical knowledge and confidence, as well as the preceptor benefits from being exposed to new perspectives and ideas for patient care responsibilities from those that are learning from you. It can be difficult to manage multiple learners at once, but it's ultimately a great opportunity to utilize the learners to both have them learn at their maximum ability, but it also frees up some of your time that you can work on additional commitments within your own role.
Especially with giving us new perspective and ideas. I count sometimes on my residents and students to keep me in the loop of other disease states I may not necessarily be caught up on with being specialized in a certain area, but it is definitely beneficial to all parties and can be tailored to what fits your practice setting. Don't be afraid to get other healthcare professionals involved in their layered learning. It can help promote their collaboration as they learn about scopes of others within the practice setting, how we can be mutually beneficial to each other to optimize patient care. And this enhances their communication skills overall across the board with tailoring it to different fields of healthcare. It can also help increase pharmacy presence across the board and awareness of residency programs for pharmacy across the multiple medical professions. There's still so many that I encounter in clinics sometimes every day that aren't aware of the residency programs for pharmacy and are very impressed by our residents.
I'm sure they're impressed by your residents. For anyone who's interested in learning more, where can they find additional information?
ASHP has a great guide. It's the guide for best practices with layered learning. The link will be in the show notes detailing how your day can look, what the benefits are, where to incorporate this best.
We are also working on a toolkit for layered learning through Vizient. This has not been published yet, but it is in the works and should be published really soon in the near future.
Thank you, Sarah and Kimberly, for joining us today to share your insights and experience and helping us truly understand the impact of layered learning in pharmacy residency programs and why this model continues to shape the future of pharmacy practice. It's been great chatting with you.
Thank you so much, Carolyn, and it's been a pleasure chatting with you all as well.
Yes, thank you so much.
Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified RX is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.